Hello, my name is Frida Adapting and I am a PhD student at Uppsala University. Today I'm going to present to you the behavioural study, which has the overall aim to develop and adapt a guided low-intensity behavior activation intervention for people with dementia and depression. So just to give you a little background to the study, depression is common among people with dementia. And even though evidence-based psychological interventions are effective, the access remains low. It is therefore important to develop psychological intervention to help people with dementia and depression to live well and promote healthy aging, as well as increase access and reduce costs of psychological interventions. Behavior activation, or BA, is one approach that might help close the gap between the needs and the access for this population. BA has been shown effective for treating depression in a general population. So, given the promise of BA, a guided low-intensity BA intervention informed by the Medical Research Council's Complex Interventions Framework was developed in the United Kingdom. During the intervention, the person with dementia receives support from an informal caregiver to have them use the interventions in their home, and the informal caregiver receives guidance from a trained healthcare professional. However, before implementing the intervention in Sweden, we need to adapt it to fit the Swedish context. So this study has a mixed methods design using approaches from participatory action research, or PAR. We are currently recruiting people with dementia and informal caregivers, and we have already recruited 18 healthcare professionals and 7 representatives from non-governmental organizations, or NGOs. The study consists of 4 iterative part phases, where we will conduct 2 rounds of interviews with people with dementia and informal caregivers, and 2 rounds of focus groups or interviews with healthcare professionals and NGOs. Along this, we are also in the process of establishing a patient and public involvement group. The first round of focus groups and interviews have been conducted, and we are now starting to analyze the data using content analysis. So, as I mentioned, we have just started to analyze the data that we collected from focus groups and interviews with healthcare professionals and NGOs. And I would like to share some very preliminary results with you, and I will present the results as facilitators and barriers for implementing the intervention. So first, I just want to say that we got a very good response and positive feedback from the healthcare professionals and NGOs. They have really emphasized that the availability and the access to psychological interventions are low, and that this intervention has the potential to fill this large treatment gap. They have also said that the intervention and the workbooks are structured, elaborative, and relevant for this population. The intervention offers informal caregivers with a concrete tool to support people with dementia. It is a positive intervention. Focus is on what is functioning in the lives of people with dementia rather than what is not functioning. And it is beneficial with meetings both face-to-face and via the telephone due to the often busy situation for informal caregivers. During the focus groups interviews, they also identified some barriers. Language translation challenges, for example, with language structure and idiomatic expressions. The workbooks needs more diversity to reflect the Swedish culture. The workbooks were overwhelming at first sight, but got better as you got more familiar with them. Implementation of new interventions into routine practice is often difficult and requires, for example, politicians and decision makers to be involved and engaged. The importance of training and supervision of intervention providers, as well as to individualize the intervention to fit as many as possible. But also discussions about who will deliver the intervention, how often, where, and what mode of delivery for the support sessions. By that, I would like to thank my colleagues and our organization collaborators. Thank you so much for listening.